Hey, so let me just quickly try to explain the changes to Medicaid that are in the big, beautiful bill. Okay, right now there's about just under 80 million people on Medicaid. Medicaid is different than Medicare. I'm on Medicare, which means I'm over 65. My entire life I've paid into this system, right, where they take a little bit out of every paycheck you have for your life. And then when you turn 65, you get health insurance for elderly people. We get it at a discount. It's not free. I pay like 185 bucks a month for my Medicare, and then there's also co-payments depending on what I'm getting. But it's good insurance. And again, this is something that's they say it's an entitlement, and it's kind of earned because if you look in your pay stub, you'll see your little your Medicare deduction that you take. So you've paid it in your whole life. And if you live to 65, then you get to take advantage of it. So, hey, I'm 67. I survived. Now, Medicaid is for poor people. These are people that don't make enough money to have their own medical insurance, and they don't have a company health insurance. So about just under 80 million people are on Medicaid. That's about 25% of our country is getting basically Medicaid health care paid through our taxes. So that's kind of what we agreed that, people don't have enough money. We don't certainly want them to not be able to get the health care they need, particularly if you're a child. Now, when you keep hearing about 17 million people are about to be taken off of Medicaid, what that is there's a change. It's called a work requirement. And what it says is if you're an adult and if you have no children and if you have no disabilities, then you have to either work or volunteer at least 20 hours a week in order to qualify for Medicaid. You have to, if you can't, for whatever reason, find a job in your area, which is hard to believe for me, honestly. My friend just got a job at Costco for 20 bucks an hour, and they have no experience whatsoever. Pretty excited to get full benefits and everything. But anyway, you have to at least prove that you're looking for a job or that you're working part-time at least 20 hours a week in order to get Medicaid. Now, again, this is not for your kids. This is not for people who have disabilities or unable to work. These are for people who are adults that are capable of working, that have no dependents, but they're simply not working. And the government is now saying in this big, beautiful bill that, yeah, if you want to get free health care, if you want your fellow Americans to pay for your health care out of their, tax dollars, then if you have no disabilities and you have no children and you're an adult, then you have to work at least 20 hours a week in order to qualify for these benefits. If you don't, if you're sitting on your butt doing nothing and you want to get free money because you're poor, then no, they're not gonna give you free health care unless you're working for it. And the idea behind this is there's a lot of frankly fraud. There's a lot of I'm not gonna okay. My sister-in-law, married to my younger brother, she's what we call divorce rich. She had a rich husband, and now she's got a $1 million home. She owns free and clear. They got a boat. She goes on vacations all the time, but technically she has no income. So when she fills out she was telling me, a few months ago we were talking about health care because my wife was looking for health care. It was going to cost her about $350, $400 a month. She's young and healthy, and she's saying she pays 37 bucks a month. And we're like, well, how the hell you pay $37 a month? She said, well, I'm on Medicaid. Like, you're on Medicaid? We're over at her house, her $1 million home on a lake. And she says, yeah, because I don't have a job. I don't work. So, they give me Medicaid. And I'm like, you don't work. You're damn well rich. So apparently they don't also on Medicaid. It's a matter of your income. So if you have assets, like, you happen to own a, beautiful home, or you have other money, then you can still get Medicaid as long as you don't have an actual income, which again frustrates the shit out of me and people that pay taxes to say, come on now, we want to help out our fellow citizens if they really need help. But the problem is what you've heard a million times, the fraud and abuse. It's when the government doesn't do a very good job of checking on you. They don't have the resources, or they don't allocate the resources to really say, well, where do you live? How do you pay your bills? How much money do you have in the bank? Do you have any stocks, bonds? Do you own real estate? They don't ask those things. They simply say, are you employed or how much money are you making? And so this law is going to basically kick her off, which I think is great. It's going to say, no, if you're not, you need to work in order to get this money. So again, if she's willing to go to work for 20 hours a week somewhere, then she can still get Medicaid, which I think is bullshit. I think they should audit your assets before they give you a bunch of money, or free services. But anyway, that's not in this bill. So when you hear about the 17 million people that are going to be kicked off of Medicaid health insurance, these are people that really don't want to work or refuse to work and still are collecting benefits. And those people, if they're not going to get themselves up and get a job, at least a part-time job, then they're going to get kicked off the rolls. And what you're really talking about is about 16, 18% of the people collecting Medicaid, and they're fraud. They're basically stealing from us. And I don't know why you would get so upset about that. It's your tax dollars. You work hard. Look at your paycheck. Look how much money they're taking out of your paycheck. And a lot of that is going to help people that need health care that can't afford it. And so to thin out or to expose the people that are stealing from us, that are collecting benefits that they actually don't deserve or need, or they're not willing to work for, is, I think, a good thing. But anyway, that's just my opinion. The fact is, you can do a little bit more research on it on your own if you have any desire to. But please keep in mind, they're not like taking poor people and throwing them off Medicaid. They're certainly not taking disabled people or poor children off of Medicaid. That's not part of this bill. This is for adults with no children or dependents who have no disability of their own. And these are the people that are now going to be required to work in order to get Medicaid. All right? I'm sure no one's going to watch this video, but I told you the truth. Bye.